None of these factors have changed significantly since 1970, yet the rates of autism has skyrocketed. The mother texted me 6 months later, "Dr. Doan, my daughter caught up with her sister. People cannot tell any difference between the girls. Changed his developmental trajectory and changed his life." If you have a child in your family with autism, then you will want to watch this video to the very end. What I am going to share with you, most doctors and medical professionals do not know. And if they do know, they may not have time during their busy clinic visit to actually explain to you the developmental consequences of excessive screen time and the use of too much screen time in children on their developing brains. At the end of this video, I will share with you 2 cases that were amazing. One involved a 6-year-old girl, the other one was a 10-year-old boy who completely dropped their autistic symptoms. The boy was severely autistic, and he changed his developmental trajectory by implementing the recommendations that I'm going to share with you in this video. I'm Dr. Andrew Doan, and I have trained over 2,000 medical providers on what I'm going to share with you today. The causes of autism are multifaceted and complex, involving a mix of genetic and environmental factors. It's important to understand that there is no single cause for autism, but rather it's a combination, a collection of factors that increase the risk and the likelihood of a child developing the condition. There are genetic factors. Autism tends to run in families, suggesting a genetic component. Changes in certain genes increase the risk of developing autism. More than 100 genes on different chromosomes may be involved. These mutations can be inherited or they can arise spontaneously. If an individual has specific genetic mutations, they might be more susceptible or at risk for developing autism, particularly when combined with certain environmental factors. There are environmental factors at play. Advanced age in either parent is also associated with an increased risk of autism in the child. Pregnancy and birth complications may also play a factor. Complications such as extreme prematurity, low birth weight, and twins or multiple birth pregnancies have an increased risk of developing the condition. Pregnancies spaced less than 1 year apart have been linked to a higher risk of developing autism. Prenatal vitamins containing folic acid taken before and during pregnancy may play a role. Taking folic acid decreases the rates of autism by 40%. There are biological factors. Autism is associated with problems in brain connections, growth or overgrowth in certain areas of the brain, metabolism issues, and immune system irregularities. These factors can impact crucial aspects of early brain development and affect how brain nerve cells communicate. Let's discuss vaccine-related myths. It is critically important to note that extensive research has shown that there is no link between vaccinations and autism. This includes the measles, mumps, and rubella vaccine and others that contain thimerosal or aluminum adjuvants. The rates of autism are increasing at alarming rates. Some of the increases is due to better recognition and diagnosis or overdiagnosis. But overdiagnosis alone can't explain the increases that we've seen since 1970. In 1970, the rates of autism was 1 in 5,000 children. In 2000, it was 1 in 150. In 2020, it was 1 in 54. In 2023, the CDC raised it to 1 in 36 children. If we look back at all the possible factors, genetics, environmental factors, biological factors, none of these factors have changed significantly since 1970, yet the rates of autism has skyrocketed. The big elephant in the room is how much media our children are exposed to and consuming. If your autistic child has been consuming a large amount of media, please be kind to yourself and do not place unfair blame because you didn't have this information. Consider this video as an opportunity to help your child as you reconsider their media use and its possible impact on their autism. Virtual autism is a term used to denote autistic symptoms in children primarily caused by excessive exposure to screens from devices such as televisions, computers, tablets, or smartphones, especially at a very young age, typically under age 3. Virtual autism has been written in the academic research literature by several doctors, such as Dr. Harley, Dr. Christakis, and Dr. Heffler. The concept of virtual autism emerged from observations that children displaying autistic behaviors tend to have a history of intensive screen exposure, and that some of these behaviors seem to abate when screen time was reduced or eliminated. We have seen young children with severe autistic symptoms drop their autism diagnosis after 6 months of zero screen time. Children born with autism show improvement too, because without screens, their developmental trajectory changes for the better. Screen time does not necessarily cause all cases of autism, but too much screen time will make autistic symptoms worse in every single case. People have asked me, but you're an ophthalmologist. Why are you talking about autism, Dr. Doan? I am an ophthalmologist with a PhD in neuroscience. Therefore, I understand brain development. Also, as an ophthalmologist, I see a similar neurological condition in the brain that controls vision in the visual cortex. In babies, when there is a visual obstruction in one or both eyes, the visual signals to the visual cortex are disrupted. If left untreated, the child loses vision daily because the visual cortex at the back of the brain atrophies or shrinks. The vision loss will become permanent if left untreated. This is known in the field of ophthalmology as amblyopia. To treat amblyopia, we correct the problem causing the visual obstruction, such as a lazy eye that wanders off, a cataract, a droopy lid, or anything that obstructs vision in the eye. Then we patch the better seeing eye for 6 or more hours a day. This forces the brain to use the weaker eye and strengthens the connection between the weak eye and the brain. We can clinically observe the worst seeing eye, the amblyopic eye, improve vision monthly. If treated early, then we can see normal vision in 6 to 12 months, and both eyes will be equal. Virtual autism is similar. The digital media is holding your child's attention at the cost of redirecting neurological development away from the brain areas associated with speech, eye contact, emotional regulation, social communication, creativity, and numerous other skills. While watching repetitive videos and gaming for hours and hours daily, your child overdeveloped skills learned from the videos watched or games played. With years and years of digital media for 6, 8, or 10 hours more per day, the brain strengthens the centers associated with the processing of media being consumed. In other words, your child develops exceptional visual skills, visual processing abilities, and other abilities. The videos or the games are training their brains. But your child's brain will neglect other important brain areas, which will atrophy and shrink. When this happens, this appears as autistic symptoms, such as delayed language skills, delayed movement skills, delayed cognitive or learning skills, hyperactivity, impulsiveness, inattentive behaviors, unusual eating and sleeping habits, gastrointestinal issues, and unusual mood or emotional reactions. Recall what I said about biological factors. Autism is associated with the problems in brain connections, growth or overgrowth in certain brain areas. The excessive use of digital media will cause growth or overgrowth in certain areas of the brain because neurons that fire together will wire together. It sounds odd, but urinary and gastrointestinal problems can be associated with too much screen time. I have worked with a 7-year-old boy who had trouble with urinating and soiling himself daily. His pediatricians did not find a medical reason. The boy was using his digital tablet for 6 to 8 hours a day. I was able to convince his mom to remove all electronic devices that were related to entertainment. The screen time for education was acceptable. Within 1 month of taking all entertainment media away, the urinating and gastrointestinal issues resolved and remained resolved in this little boy. In an academic review paper by Dr. Mupala and team, they stated that excessive screen media usage in children can have both positive and negative impacts on their development. Regarding cognitive development, screens have the potential to enhance education and learning. However, studies have shown that excessive screen time and media multitasking can negatively affect executive functioning, sensory motor development, academic outcomes, Early screen exposure has been associated with lower cognitive abilities and academic performance in later years. Language development is also affected by screen time, as it diminishes the quantity and quality of interactions between children and caregivers. The negative impacts associated with excessive screen time, particularly a decrease in executive functioning, lower cognitive abilities, delayed language development, and detachment between children and caregivers, look very similar to the symptoms observed in autistic children. If you have a young child with autism, or a grandchild or a niece or nephew with autism, then there is hope. To re-emphasize our previous statement, we have seen young children with severe autistic symptoms drop their autism diagnosis after 6 months of zero screen time. Not everyone will see similar results, but you will see a positive change in their developmental trajectory. Children born with autism show improvement too, because without screens, their developmental trajectory changes for the better. This is similar to how we treat visual amblyopia with one strong and one weak eye. By removing the digital media, you will be patching the brain that has developed a strong neuronal attraction and pathways towards media, and now forcing the underdeveloped areas of the brain to develop. Let's consider the case of the twin sisters who were about age 6. One girl used her digital tablet for a number of hours per day, and the other girl was not interested in her tablet at all. The girl who used her digital tablet excessively was developing autistic symptoms. The mother was encouraged to cut back significantly or remove the digital tablet completely. Within 6 months, the girl who was behind developmentally caught up to her sister and was no longer considered to be on the autistic spectrum. The mother texted me 6 months later, "Dr. Doan, my daughter caught up with her sister. People cannot tell any difference between the girls. You changed my daughter's life." About 2012, I gave a talk on digital media and brain development to a group of doctors. One of the parents in the audience had a severely autistic boy who was about age 10 at the time. The family decided to remove all screen time from their son, who would have a temper tantrum and require being bear hugged for an hour after his tablet was taken away. This family continued to remove all digital media from their son's life. I saw the parents 9 years later, and they proudly informed me that their son is now a high-functioning autistic man and that he graduated from high school. People can't tell that their son has autism. This couple is certain that the removal of digital media from their son's life changed his developmental trajectory and changed his life. These stories are not isolated incidences. I have communicated with doctors, early intervention therapists, and professionals around the world who have observed similar results with the removal of excessive digital media. We all know that digital media and devices are convenient babysitters for babies and our children. Unfortunately, using electronic devices to sedate and entertain our children for hours and hours daily will have devastating neurological consequences. Similar to the permanent vision loss that occurs in amblyopia, we are seeing permanent neurological changes in the brain associated with excessive use of digital media. How much is excessive? In 2010, the average American child was already using 7 hours, 38 minutes a day of entertainment digital media. The children today are using more because of the availability and the lower cost of mobile devices. The brain is neuroplastic and can change, but less so as we age. The brain is fully formed and mature by about age 25. Therefore, the earlier the removal of excessive digital media consumption, the more impact it will have on brain development. The later intervention, the less impact it will have. It is important to continue the treatments that are currently being recommended by the child's current medical and healthcare team. Discuss with your child's providers your plan of removing entertainment media from the child's life before implementing your plan of doing so. Dr. Victoria Dunckley is a pediatric psychiatrist, and in her book, Reset Your Child's Brain, she recommends an abrupt 3-week fast. In her psychiatry practice, she sees anxiety, depression, behavior problems, and mood disorders diminish significantly in just 4 weeks. Dr. Nicholas Kardaras recommends a gradual tapering of media followed by a 4-week detox in an effort to avoid explosive episodes that are often triggered when kids abruptly start detox. I think if you have a young child, an abrupt fast is easiest. However, if the child is closer to adolescence, then a gradual tapering is safer. These digital detox steps were written by Dr. Jeffrey Hansen, a pediatric and adolescent psychologist. Dr. Hansen and I are good friends, and we're going to release a new book titled Electronic Media and the Struggle for Connection. If you want us to notify you when the book is in print, then either post in the comments below or send me an email at andy@andrew-doan.com. Step 1. Get your own media use under control. Before you begin, your child will be observing you, so you need to taper off your own media use for this to be effective. Step number 2. Explain to your child why you're doing this. This helps a child to understand why life is going to change soon. Be confident, yet kind. Remember that for many kids, the electronics have been tantamount to an additional organ, and removing it can feel like surgery without anesthesia. Moreover, many children have never lived without media and will find it hard to even contemplate living without it, even though the media detox is only 4 weeks long. In short, expect your child to protest or even possibly have a complete nuclear meltdown over the prospect. It might be appropriate to share in a distilled form the relevant content of this video to your child. Moreover, many teens should be afforded the opportunity to view this video. I would not force the issue, however, if they show little interest. Step 3. Ask for your child's cooperation, but not for permission. You are the parent and should set healthy boundaries. The human brain is not fully formed until age 25, and this is why insurance companies give us discounts on car insurance at age 25. Your child does not have the brain maturity for self-control and needs you to set those boundaries. Step 4. Set up a start date and schedule that works for you and your family. Many people find Mondays the best time to start, as weekends are typically when there is more downtime, and thus are often more difficult times to start. This way, you will already be 5 days into digital detox by the time the weekend comes around. Step 5. Perform a clean sweep of your child's room. Remove all electronics with the exception of possibly a radio. Step 6. TV time. Although I recommend that TV viewing be included in the digital detox, if you feel that this would be best, I suggest that TV time be limited to family viewing only with a maximum of 1 hour per day. Step 7. Obtain toys, games, and activities to fill in the void of not having screen time. Ensure that you are giving your child more access to non-electronic games and activities. On the other hand, don't worry about filling every minute of their time with these activities. It is okay for a child to be bored, as this promotes creativity, a diminishing quality in many children who overuse media. Step 8. Increase connection with friends and family members. Remember that increased connection with family members and parents during detox is extremely important. I strongly recommend fun one-on-one time with your child each day. Kirsten noted that studies have shown that children who regularly eat dinner together with their families evidence significantly less at-risk behaviors, are less likely to develop mental health problems and disorders, and are much more likely to do better in school. Please ensure that the TV is off and no one in the household brings any media to the family dining table. Finally, never let your child eat alone in their room. Eating should always be a social event. Step 9. Have your child surrender their cell phone during digital detox. This will be the hardest thing for many teens. If having access to a phone is absolutely necessary, possibly for safety reasons, purchase a phone that has no access to the internet and is not capable of texting. A second alternative is to disable texting and internet functions on their smartphone, but this is much less desirable because kids know how to bypass your parental locks. Step 10. Secure access to the internet on the family computer and any handheld devices that the parent might have. If not done, most kids worth any grain of salt will conduct covert operations and will find a way to get their electronic cocaine. I know of parents who locked the router in the home office on the second floor. In the middle of the night, the child climbed up onto the second floor balcony, broke into the office and acquired the internet router so they could connect to the internet and play in the night. Remember that many kids and teens are a heck of a lot smarter about this stuff than we are. Step 11, get your kid outside and connecting with nature. Nature is medicine to an over-aroused brain. Step 12, get your kid exercising. For some kids, this will be natural, but for others, extremely difficult, as an alarming number of children get virtually no exercise at all and are very out of shape. The extent that the exercise is fun and is an activity that your child actually likes is a win for everybody. Step 13, once you have completed the digital detox, it will be critical that you determine how much media will be allowed, if any. Otherwise, things will definitely drift back to the same old patterns and you will be back to square one. This is otherwise known as gravitation towards the mean. We recommend that a media contract be implemented to keep everybody honest on the same page. For autistic children, even a little media may be too much. The best results are seen when there is zero exposure to entertainment media for autistic children. In young autistic children, parents share that they see the most significant improvements at around 6 months. I am interested in your questions and comments about virtual autism. If you have any success with your child when removing media, then please share your experiences below for the benefits of the others in the comment section. Help me spread this important message, and to receive additional health tips in the future, please like, subscribe, and turn on notifications. Until next time, I wish you health and joy.